Hi, everybody. Welcome to another episode of Princess and the Pod. I'm your host, Yvette, and today I have a special guest, Dr. Steve Litwin, the owner and founder of Dental Defense. And we'll get into that later. But before we get into that, Steve, introduce yourself to everybody. Let us know where you're from, how you got interested in dentistry, perio, and all the fun things.
Sure. So right now I'm based out of Boston. I get here in the harbor there. I'm based out of Boston, originally from New York. So I went to dental school in SUNY Buffalo, did college at SUNY. I did GPR, and then I followed up with my perio program at the University of Kentucky. Then I ended up in Massachusetts just because I had some colleagues here. It's a great place to practice perio. And it's been here for about 8 years now, and it's great. I think getting into perio, how I got into it is Barry Wagenberg was a big influencer of mine. He kind of lived down the street. And ever since I was a little kid, everyone always talked so highly of him, and he always loved his job, wouldn't stop talking about it, seemed to have a nice lifestyle. So I said, all right, that's what I'm going to do. So I'd say about the age of 12 or so, 13, I said, all right, I'm going to be a periodontist, which is most kids want to be firemen and police officers. And I want to be a periodontist.
Right.
So yeah, here I am.
That is so crazy because I feel like most perios don't hear about perio until maybe dental school, probably after, because we're only exposed to SRP, oral hygiene instructions, and you're just like, what is this? But if you get to truly see what perio encompasses, like, how could you not fall in love with it, you know?
Yeah, I mean I didn't really know half of what he did. I mean, my exposure to perio was implants, really. I remember going to his office at maybe 15 or so. I was in high school, and I watched him do an immediate implant on a premolar with an osteotome. And I said, "Oh my God, this is what he does. This is awesome." And so I had no idea the concepts of crown lengthening, soft tissue grafts, osseous, SRP. I had no concept of that whatsoever. And then I got a little exposure to it in dental school, and then obviously more exposure in perio. And then just kind of fell in love with that also. And it's just fun, and it's been a fun trip so far.
Nice. Yeah, I love perio too. I have a little bit of an opposite story. So my dad's best friend is an orthodontist, and he has a brother who's perio, and I ended up working for the brother for a bit. It was a great time. I had a good mentor. He taught me everything. It was that ideal, like, I'm going to give you all my patients, like his best friends. He's like, I'm not doing surgery. Yvette is great. I wasn't. I was a resident, like fresh out of school. But when I saw the ortho, I was like, I want to do what Dr. AD does. He just walks around, tells people what to do. And like it, and then I ended up specializing in perio, which was the other brother. But, no, perio is awesome. So, do you feel like Boston is home? Do you think this is where you're going to stay? Do you love it? When you're like, can I sit by the bay? And I was like, yeah, I'll sit by, I'll give you a little, they're doing construction, but here's, it's close to where we had women in perio, like very close, but my office is like 10 minutes from here. Do you love Boston? Is this home?
Yeah, this is the new home, right? I think I mean, I've invested myself in here, relationships and people, businesses, and it's a great spot. I think like Boston itself, or just outside of
Yeah.
Boston, you're right by the airport. You have nice, beautiful beaches. You have a lot of academics. It's a nice place to
Mhm.
practice, and it's a nice place to continue learning because there's always, the Harvard's here, BU's here, Tufts is here. So there's a big dental community that surrounds this area. So it's nice to have that infrastructure also, because dentistry is a little bit more sometimes than a profession. I think for a lot of us, you know, uh, I mean, that's a lot circles around it. Your friendships, your relationships. Um, it's a little more
Mhm.
passionate than I think most professions. And I think having that infrastructure kind of built into the location, it is a nice little adjunct to the place here. Plus, Boston's just nice history, nice. It's just cute. It's a cute place. I like it. Minus the taxes.
It is cute. It is cute. I'm gonna take a pause from the pod. If you see me blurry, it's okay. Just keep talking. The buffering sometimes is weird. So if I look pixelated, because on my end you're pixelated, but when the pod like puts it together, it's not gonna be like that. So if it seems blurry or there's a gap, just keep going. Okay.
Yeah,
Um,
you've been pixelated
okay,
this whole
so
time, so
hopping back on. Uh, it's okay. Um,
oh,
So I've been
cool.
to Boston twice. Once in dental school, we have a like research forum where all of the dental schools present their research. Loma Linda used to have it as a requirement. Then we go to CDA. Then we compete against like UCLA, UCS. No, not UCSD. UCLA. Well, UCSF, USC. Like and somehow me and my two girlfriends got first place. It was very interesting because we measured pH on anesthetic buffers, but we won and we beat everybody. So then we got to go to Boston to compete and we got annihilated by some kid who was doing like some crazy research and that was fun because we got to meet people from other schools. Loma Linda is a different type of vibe. It's a private school. We were very sheltered. So we got to see what the whole world was about. And then I got to go again for one of the AAPs that was there. I died.
Yeah,
I truly died. I don't have a winter coat that I don't know if it's always that cold, but like, hello, like it was freezing. I'm actually really cold right now. Like, I think it's like 73 and I contemplating going home to go get a jacket. So that would be my only
get out there.
okay, there we go. Okay, we're good.
That would be your only thing.
So the cold.
Cool. All right. No,
The
I would
cold?
tell you, that Boston's great during the summer, and it's great during the fall, and it's probably even great during the spring. I could do without the winter. Now I see why people are snowbirds for sure. But I mean, you can't beat New England in the
Mhm.
summer and in the fall, but it's quick. It's your quick trip to Vermont. I mean, I don't know if this is a pitch for Boston, but it's a quick trip to Vermont. You're right by the airport. I mean, right by the beaches. But yeah, during the winter, I would stay away. And it's like in Buffalo. I mean, I came from Buffalo Dental School, and I remember there was 12 inches of snow on the ground, and classes were not canceled. And then I remember my perio residency in Kentucky, there was about an inch on the ground, and they like shut down the whole town. Um,
Hmm.
which is,
Yeah, yeah, yeah.
fine by me, fine by me.
So you went to UMKC for perio, right?
No, so I went to University of Kentucky in Lexington.
Oh, okay. How'd you end up in Kentucky?
That's a great question. So when I
Kansas
was in
City.
dental school, no, Kentucky, University of Kentucky, in Lexington, Kentucky, not Kansas City.
No, here's the thing. If you're from California, like you have no like reference to where anything else in the US is, like at all. I have a map
So
and I'm
I'll
trying to memorize all the states. So
so I'll,
bad.
so I'll tell you that I didn't know where it was. I mean, I grew up in Long Island in New York. I mean, all my
See?
family was. I mean, I'm third generation like New Yorker, and I had to look on a map where I was like, "Where's Kentucky?" I know it's in the South somewhere, but it's a beautiful town. Like it was a stunning town, and gorgeous horses, good people. Like it was fun. But how I ended up there was I was in my GPR. Am I still with you? You guys good?
Mhm.
Yeah, sorry. So how I ended up there, I was in my GPR. I always spent a lot of time with the Perry residents in Buffalo. Spent a lot of time shadowing everyone, and you really got to know the faculty at Perio at the University of Buffalo. And at the time, I was finishing my GPR. I'm like, all right, I'll apply to Stony Brook. It looked at Stony Brook, it looked at NYU, and then someone had dropped out of the program at Kentucky, and the director of Buffalo calls me and says, "Hey, you want a spot?" And because he knew someone that was part of the program there, I said Kentucky. I looked on a map. I said, "Well, you could start a year sooner. It's in-state tuition. They do 300 implants a year for each resident, or 300 implants per. for the life of the residency. And I
Hmm.
said, sure, start a year sooner. I won't be in an extra 300,000 in debt. I've never been there. Let's go. Why not? So I went there, and it was the best thing I think I've ever done. And I owe so much to that one phone call from the director of Buffalo. So Dr. Othman Shibley, thank you. I'll always say thank you. And Dr. Muhammad Al Sabah, I'll always say thank you
Oh.
to those guys. Yeah. So yeah, that's
Do
when I
you
ended
bump
up
into
in
them
Kentucky.
like at AAP meetings? And
No, I haven't bumped into him. Sometimes
do
I'll
you
give
end
him a
up
call just
bumping
to say
into
thank
them
you.
at AAP? No,
No, I've not yet bumped into them. I need to go to more AAP meetings, to be honest with you. but I will call him, and
don't we
I
all?
will yeah, I will call him and I'll thank him, and um I'll do like some hybrids for the day, and I'm like, without these guys I'd never be doing this. So but that's, I mean, that's really the key, I think, is mentorship and things like that.
What was your experience like in residency? Like, how many co-residents did you have? Were you guys close? Did you guys work closely with there's a bee like about, and I'm allergic to bees. It's okay. Um, were you close to your co-residents? Did you guys get along? Were you close to the dental students? How was the cohesiveness within your like school and program?
So I mean, I have a big smile on my face thinking about it. Uh, so my that program was very small. They alternated 2 residents and then 3 residents a year. So it's 2, 3, 2, 3. So my co-resident was Dr. Brittany Kaminish, who she was born and raised in Kentucky, and we were very close. There's no question. I was like her brother. She was like my sister. I got to know her
Yeah.
family. They took me in terms of like during the holidays, and
Yep.
because what's a kid from New York gonna do in Kentucky? And so she kind of took me under her wing a little bit.
Yeah.
It was really nice. The dental students, I mean, what am I? I was 26 or so in as a resident, and some of the dental students were 27, 26. So,
Okay.
you get your core group of like dental school buddies. And I mean, residency, I think, was the best educational process that I've ever had between college, dental school, GPR. Specialty was the best because you're a
Same.
dentist already. The pressure's gone.
Same.
You could really start to do the things you wanted to do. And, and I
Hmm.
started moonlighting more than I should have, perhaps. Uh, but it was really the best time. We get together, we'd have all these parties. I mean, I think you talk to most people that had the perio residency, I think they had the very similar experiences in terms of just having a good old time, I think, you know.
I don't know. So I've interviewed a bunch of perios, and for me, I was saying like perio was very easy. I mean, I had a tough time in the beginning, but I really liked it. I enjoyed it. I felt like I had a good life balance. Like it felt really good to me. But a lot of peri residents are like, it was so hard. And like, I had a tough program. We were really lit heavy. We had tests, we had exams. Like, we had to cold hard memorize a bunch of stuff, but I had so much fun. But I think because I really liked it. So you probably felt the same. Yeah.
I think I just might have been a slacker relative to all my other co-residents, to be honest. Um, but I mean, there were stressful moments,
Oh,
obviously,
no.
but I think, I mean, when you're in dental school, at least for me, like you're so worried about graduating. At this point, you have your degree. No matter what happens, like you're still a dentist. Like you still made it, and I think that took a
Right.
lot of the pressure off. You know,
Yeah.
at least for me.
Yeah. No, that makes sense. No. It makes sense. And then you got that like Southern hospitality from your like co-resident and all that. So I like the small groups. It's hard to like teach in bigger groups where there's more residents, different personalities, all that stuff. So how did you end up from there and then you went to Boston? Was it a academic position or like what took you there?
So that's a good question. So believe it or not, when I was in Perio at UK University of Kentucky, I would moonlight, and so there's a flight from Kentucky to New York, which is about a 2-hour flight, and so there was a Perio practice
Okay.
in Queens, New York, and so I'd hop on a plane Friday night, and uh, I'd fly back to Long Island. I would work Saturday in this perio office just doing osseous. The guy wouldn't give me any implants, just straight osseous.
Yep.
Sunday, I would go to the beach,
Um,
and then
yeah.
Sunday night I'd fly back. And so I was
Like,
working in New York for a
yeah.
while while at you know while in Perio in Kentucky. So when I finished up Kentucky, I naturally started working full time at that office, and then I met some folks here in Boston that had a nice practice, this great opportunity, and I said, "All right, I'm gonna go up here," and I'm very happy that I did. So I got to meet a lot of good people, learned a lot,
Nice.
and it's been nice. Yeah.
Have you been doing any like academics, locally teaching, anything like that?
So it's I've thought about it. I had a conversation a couple of years ago with Paul Levi from Harvard. We were talking about having me in there to teach. I was going to do. They wanted I think a day every other week, and at the time it
Hmm.
was my clinic was really moving, and I don't want to cut out my clinical time. I think now looking back on it, it'd be nice to kind of use that time. But I looked into it. I thought about doing it. But for me at the time, like you're just starting, it was too much of a commitment outside of the clinical, like my
Hmm.
actual clinic and doing surgeries, and so I opted out of that. But I think it's nice to have. I remember in Perio we all had to teach on the floor, and I did a GPR at the time. I was moonlighting in Kentucky as well as a general dentist, just kind of had more heavy Perio. So I mean, teaching students, your mistakes is kind of it is really genuinely rewarding. So here I was as periodontist walking around the
Hmm.
floor, so, trying to help these guys with crown preps and treatment planning, implants, and a little bit of everything. And so, I mean, I think that also just
Nice.
kind of makes you a more well-rounded periodontist is having a good, fundamental and foundation with of restorative dentistry. But I think teaching is, everyone should do a little bit of it. It is very rewarding, no question.
It is. There's pros and cons to both teaching, not teaching, teaching later. You can always go back and do that. So I'm curious how you know a lot of my friends.
Uh,
Jess Lou, Gaia. Like we have a lot of mutual friends in common.
Yeah, I think the perio world is very small. I mean, how many periodontists are in the U.S.? There's like
Yeah.
3,000 or so, 3,500. And obviously Boston's kind of there's three dental schools in Boston. So I think it's
Hmm.
just time. I think you just meet people. I've given a lot of lectures on implant complications, hybrid cases, and things like that. So Yankee Dental, I try to stay active. I'll teach for Hyosyn implants.
Hmm.
The CE course for. I'll run the head of the CE for my district. There's about 400 dentists in it. Um, but it's just a small world. And I think if
Nice.
you get it, use it. It's nice to connect with these people, and also it's just friends of friends, right? It's like good people, surrounded with good
Yeah.
people. So I mean, I met Guy through one of your colleagues, one of my colleagues, Darren Khan, who was at your event. Um, Jess.
Yes.
Oh my God, Jess is the best. My Dental Defense sponsored one of his You Discover courses, which is an incredible course. If you're looking to kind of incorporate
Hmm.
some remote anchorage or full arch, definitely reach out to You Discover with Jess and Abbas there. And Jess is an incredible
Hmm.
guy. I mean, if anyone is not familiar, he founded the Flash Cap, and he's right down the street. Like here's this guy that created this company right down the street, another periodontist, and he's just one of the most supportive people. I started Dental Defense as a once daily mouth rinse for patients with implants. It's doing a startup is challenging, and he did the same thing, and it's nice to
Yep.
pick his brain and have someone support you and kind of mentor you a little bit.
He's very smart. He's also very in trouble with me, but
I won't ask. I shouldn't ask.
um, Jess, why? He- Ask him why. He'll tell you why.
All right.
He did Serve's podcast before mine. We both know Jess very well. Jess is very private. If you're close to Jess and you're lucky enough to know Jess very well, like it's such a blessing. However, I'm not happy that he did Serve's podcast before mine. And I just did a pod with Fadi last week, and we always do like a call up, who's next, who would you like to see? And Fadi's like, Jess. I'm like, yeah, let's talk about Jess. Jess knows he's in the doghouse with me for a little bit, but he's not. I love Jess. And we're both cat people, which is awesome. And Serve too. Serve actually is a cat dad. Let's talk about your startup with dental defense. That's really tough. I would not know where to start. I would not know where to find a manufacturing company. I would not know, like, I would have no idea. And I would say I'm a little more like financially savvy. I wouldn't know where to start. Where was the idea? How did you bring it into fruition? Like, let's talk about it.
Sure. So it kind of the idea started in residency, and I was like, this is yeah, there's I have all these mouth rinses for yeah, just these generic mouth rinses that one company puts out 1,000 different rinses. It's confusing. There's nothing for implants. There's nothing for. And so I remember having a
Right.
conversation with one of the attendings. Uh, it's about like 10 years ago. He's like, "Well, that's impossible. It'll take too long, et cetera, et cetera." So I just kind of forgot about it. And then one of my buddies in New York, who's is in banking, he was doing a deal with one of the Procter and Gamble affiliates, and he was working with one of the labs. And somehow we were just chatting, and I brought it up to him, and he kind of said, "Well, that's interesting. Make a phone call." And so I'm like, "All right, let's see. I'm just curious." And he connected with the lab. We started talking, and it turns out there's with enough time, energy, and everything else, you could end up producing something like this. And so, it took about 2 years
But
between
how? Like, how?
how
Like,
oh,
where'd you get the working capital? Where'd you get the design? Where'd you get the formulation? Like, this is a lot.
it is a lot. So I mean, the formulation came from me, a bunch of periodontists, some general restorative dentists, some hygienists, because we wanted to say, like, what do we want? I mean, so they originally came from exposed implant threads. That was the original baseline for it. It's like, you
Right.
see these cases, they got peri-implant disease, you have these exposed threads, you have this rough surface. I mean, how do we get something that's going to help manage that safely and routinely? And that kind of grew into saying, all right, well, what are the other issues? Want to lower the pH. So a lot of rinses have a lower, have kind of a acidic pH. And so our pH, we made an elevated
Mhm.
pH just to neutralize that, right? Because it's acid. So our pH is 8.5. It's designed to neutralize that. And the other portion was a compliance. Like if everyone did what they're supposed to do, it'd be easy, right? At patience wise, but they
Right.
don't. So we wanted a formulation that was strong enough to use once a day without really messing up long-term, microbials in patients' mouths. And so we said, okay, well, here's this level, and we ran toxicologies on that. We said, what's the active ingredient in it? We looked at chlorine dioxide as one of the active ingredients. We want to throw some xylitol in there just for a little bit of decay prevention there. And then we said, well, patients that still have to go buy it. So we just made it, we put a subscription on it. We're like, all right. So I don't want my patients having an excuse that say, oh, I couldn't do this. Oh, I couldn't do that. And obviously nothing will
Right.
substitute brushing, flossing, water picking. Um, and so we basically try to put everything in one jar and say, all right, this is anti-plaque, decay, pH, and we didn't want alcohol in it. We took out the alcohol. We wanted something that didn't burn
Mm-hmm.
that people would actually use.
Mm-hmm.
Uh, Flavor wise, we kept going back and forth to the laboratory, different flavors, different like how long is this going to last? What's the stability tests? Which I didn't even know that was a thing until a couple of years ago. How long will this last in a jar? Is it light sensitive? Is it not light
Right.
sensitive?
Right.
It's a
Yep.
it's a it's
Yep.
a it's a pain in the butt. Working capital wise, it definitely took a lot of cars to a lot of implants. That was just I just paid for it out of pocket there. So I worked a lot of
Damn.
days.
No, you didn't do Kickstart. You didn't. Yeah, that's why you were flying back and forth. I was like, why in the heck are you? I mean, I did
Right.
it too. Listen, like I was flying back and forth between states. We can talk about that next, but you funded it yourself.
Yeah, that was a big chunk. It was. I mean, you got to believe in it, right? It's like if I mean,
Right.
it's something I believe in.
Yep.
It works, and I said, why not? I got to take a chance, and this was my chance. And
Yeah.
everyone seems to like it, and it's growing, and we're happy.
Yes. We always have to take a chance in ourselves. No, I'm glad we connected too. How do you feel about chlorhexidine?
Chlorhexidine is it's a nice rinse. It'll stain. Uh, Too much, your hygienist will hate it. I don't think, I think there's pros and cons for everything. I'm not going to poo poo on chlorhexidine. I think it has its place for sure.
Yeah.
It's not your hybrids will be
Yeah.
nice and your provisionals will be nice and brown. Um, but it definitely does the job for what it advertises. You know,
Uh, yeah. I know you're on a Instagram sabbatical, but I've gotten into some beats over chlorhexidine with people.
what,
But anyways,
what's that? I'm curious. Give me a little sample.
somebody was like, I showed the research, and let's talk about an implant that has exposed threads, right? We know what chlorhexidine does to that. And we know in other countries it's not banned, but they're not really using it. And we might be late adopters on that train. And I had somebody and they were like, da da da, this and that, blah, blah, blah. And I'm like, look at this research. Like, we have the literature that shows that this is the worst thing you can do for a failing implant, ailing implant. And people still want to challenge me. I'm like, uh, oh, God. Like, don't get me started. And I even had a cute little, I like pink. There's a gum used to make a pink chlorhexidine, and I had a cute little picture of a pink chlorhexidine thing, and then just everybody was like, and if you catch me on the wrong day, like I will go toe to
Lean
toe
into it.
on whatever I feel passionate about that day.
So I'll tell you that.
Yeah.
I mean, the chlorhexidine is not great for long term use. It's not great for long term maintenance. Um, it's gonna. I mean, the biome's gonna get messed up. It's gonna stain everything. I mean, Sri Manini actually did a study out of Stony Brook with our active ingredient in dental defense, which is chlorine
Hmm.
dioxide, and it showed decreased peri-implant disease around with patients with perimucositis. And so
Yeah.
the goal is to say, here's a once daily rinse to kind of prevent it. Yeah, I mean, we're all. I mean, there's not enough. I mean,
Hmm.
there's not enough conversation about preventing this from happening. Once the threads are there, like great, that's
Right.
we have to manage it now. I mean, obviously, soft tissue is important, bone positioning, all that, but that's not always the case. And so, I think
Yeah.
there should be a little something to help manage the health around these implants, help around margins that are exposed, open contacts. I mean,
Right.
we wish we could all do perfect dentistry, and sometimes we do, but patients
Right. Yeah.
sometimes aren't perfect patients.
Yeah, and like my last little gripe on the chlorhexidine, I think a lot of times it's prescribed as like amoxicillin. Like, I don't know what to do. I'm just going to give you this, and this is going
Yes.
to help. And it's actually hindering. I use it for two types of surgeries, extractions, because if you just leave it in the socket for a bit, all that granulation tissue just comes up. And osseous. Again, same thing. It just like gets all that granulation tissue out because we know what it does, right? It's inhibiting the fibroblasts. But I find myself in a position, at least here in San Diego, where yes, I'm placing implants, but I'm more of a like botch doctor where people are sending me the really hard cases, the all on four cases that are failing, the like ailing implants, because a lot of people are placing implants. I'm not against it. It is what it is. But because I'm having to not fix, but maintain some of these implants, because you and I know, just because you're like having a few threads exposed, it doesn't mean you have to take out the implant. Maybe it's soft tissue, maybe it's something else, but how is the patient going to maintain this implant for a longer time, right? So I think that's what you found with dental defense.
Correct, and that was the goal. And I mean, I do a lot of implanoplasties. I'll milk those implants along, and I'll put them on dental
Hmm.
defense. Help manage
Yep.
because I'll remove the threads. The threads are the cross section of a piece of calculus. I give a lecture on it. I
I
show an
know.
implant, and I show
I know.
a piece of calculus. It's the same. It's the same thing. So you gotta obviously get that polish. Like without that, I mean, everything
Hmm.
matters. But you're right. I think my practice, I'll get a lot of those. The dentist will try to manage it, and they'll always come back on Paradex. Everyone's on Paradex. Everyone's on chlorhexidine because they don't know what to do.
Right.
But I mean, I
Yep.
also believe that a rising tide lifts all ships. I'll teach general dentists how to place implants because I can't do every single implant in my area. But when they have a problem, then they come to me. When they
Yeah.
need to do a sinus graft, when they need a soft tissue graft,
Yep.
then they come to me. I mean, because they're going to
Yeah.
learn anyway. They're going to reach out anyway. I might as well be the one that teaches them and helps them through it. And as a result, my practice
Right.
grows. So yeah.
Exactly. No, I agree 1000%. No, I a few of my referrals here when I first moved here, because you and I graduated same year from Perio, but I took like a year before I moved to San Diego. Um, when I started doing implantoplasties, they're like, "What? Aren't you going to heat the bone?" Blah blah blah. And I'm like, "It's about oral hygiene, always. Like, it always leads back to oral hygiene, whether it's decay, whether it's perio." That's why we kind of used to get like called glorified hygienist or whatever. But
Gum
um,
gardener.
neither here nor there. Exactly. Okay, so if you could give advice to any of the Perio residents that are in residency now or people that are thinking about applying to Perio, interested in Perio, you and I had an unconventional route where we didn't necessarily like apply. People knew we were interested and there was a spot to fill and we took that spot and we're like, okay, we seized an opportunity, right? And I think some of like the underdogs are the ones who end up like with a little more like grit and tenacity because we're not trying to prove ourselves. We don't have to, right? But it's just a different path, I think. So, for anybody that's listening that's interested in perio, afraid to apply, I had not awful grades. I just didn't have the best grades, not making it an excuse for myself. But my dad was dealing with cancer. My uncle, who was his business partner, had cancer. My uncle had passed. Like, we really thought my dad was going to die. I just was, how in the hell was I going to show up for a pathology quiz when I'm like, thinking about my dad back home, right?
Oh,
So
definitely not.
it was, we all are going through our own journeys. So what's your advice for somebody that's maybe in a similar boat or position as us where they're thinking like, I don't know if I can do it. I think it might be hard because you and I both really enjoyed Perio and we enjoyed our residency time. So what's your advice to somebody that's
I
thinking about applying?
well, I will say that I certainly didn't have the best grades in dental school. And so,
Mhm.
sometimes the phrase, not the grades you make, it's the hands you shake can help. But you still have to have some merit associated with it. I would say go for it, obviously. I think if you want to specialize doing a residency prior, if you don't have the best grades or you're not sure, I mean, I did a GPR at Newark Beth Israel Medical Center, and I think I think like the acceptance rate of specialty after that was 90 something percent. But so if you don't have the best
Mhm.
grades, okay, do CPR. It will separate you from the crowd. I would say obviously shadow and see if you really enjoy it. But I think once you get into it, I don't think it's about where you go. I think Harvard's a prestigious school. You know, Tufts, all these schools, and I went to University of Kentucky, which when you put them side by side, it doesn't sound as good. But I think it's really what you put into it. I mean, these big cases, we're doing a lot of implants. We were standing over each other's shoulders. I mean, we were making the most of it. And I think you, I forget who said it, but you get out of it what you put into it. And I don't think it really matters
Right.
where you go. I mean, I can't remember the last time someone asked me where I graduated dental school from. I don't remember when they asked me where I graduated residency from. And so, if you're fortunate enough to pick and choose where you can go, then you're very blessed. If you're not, then take any opportunity you can and make the most of it. And like you said, I think that gives you a certain type of grit that carries through, not because you want to, but just because it becomes ingrained in who you are. And then you go out and you make Perio Princess and you make scrubs and scalpels and you do things beyond what you thought you're capable of doing. And it was a struggle, but
Yep.
you definitely grew stronger as a result. So go for it. I mean, I will never regret doing it. I'll just say that. Dental school is terrible, but at perio, I will never regret doing it. If I could skip dental school and go right to perio, I'd prefer it. So yeah,
Dental
just go
school
for it.
was awful. It was so bad. Dental school was so bad. Um, I feel for that's really, really great advice. I do feel for the students applying, pre-dent students applying now. One of our speakers at Scrubs and Scalpels was Jonah Tomo Cordial, who she'll be the next CDA president, past AAP president, the first Asian American female periodontist in the US. Like, just her, forget the titles, her sign off on any email, just Joan. Like the kindness, the humility, like I'm obsessed. And my staff, one of my girls from my team is pre-dent, and she was just like, "Can I have her email?" I'm like, "Yep." And I think there's something about that, like the humility and the kindness and the humbleness and like just keep going. But she had some good stats because she just lectured at ASDA, like the pre-dent, like association. Their GPA is crazy high. I think science GPA is like 3.8, 3.9 for science. I think I
Right.
cumulatively had a 3.7. Yeah, I think I had a 3.7. I think my science was probably like 3.4, 3.3 or something, if I could remember, like over 15, 20 years ago when I graduated college. And she and I were both like, we would not have gotten in. I would not have gotten into dental school right now with like how competitive it is. The tough part is I like numbers, and I like I don't want to say I like money. I like numbers, and I like the flow, and I like the business side of things, right? Profit and loss statements, AR, I love all of it. Their interest rate right now for their student loans is almost 10%. So I went to Loma Linda. It's a private school. I owed like 435, not including interest. And then USC is about same, a little bit higher. Uh, Add on that 10% interest, they're going to owe about $1 million to just be a general dentist.
That's scary. I have a colleague of mine. He's 4 years of Tufts. He's in
Mhm.
perio at UPenn. Smartest, hardest working guy I think I've ever met.
Yep.
And he's going to graduate with
Right.
1.2 in debt.
Right.
And it's just like it's unreal. Maybe be a
Right.
plumber. I mean, I don't know, but it's. I mean, it's
Yeah,
great. It's a
you'll
great.
make more money being a plumber.
No, I no. Don't get me started. I
Yeah.
don't get me started. But it's what you put into
No,
it.
we
But
can. We have
it's.
a little bit of time. How do you
Oh,
feel about AI?
I love AI. Oh my god, my notes. I never wrote better notes in my life. It's bet you could. It's great at pranking your friends with photographs. Love AI. Wouldn't want to be without it. Thank God it's here. I invested into it. I had a patient tell me to buy NVIDIA and TSMC 6 years ago, and I'm happy I listened. Um, so
Wow.
yeah, I love AI. It's my favorite. And to your point about dental school,
No,
it
I do.
just
I do too. Yeah.
I think you get through it with friends and people and mentors and all that. I think it definitely helps. Just want to add that in there. But AI, I love AI. What do you use it for? Are you using it in your diagnosis? Are you using it in life?
Yeah, it's my new best friend. I I tried it with notes. It's okay. Like my notes are pretty much automated, so I just have to like click a few things, add in a few things here and there. Spreadsheets, it helps me with lectures, honestly. Like I use AI for lectures a lot. I just have to add in a few things. Yesterday, I forgot what movie we wanted to go see. And then I had a whole conversation with AI. I was like, why am I so intuitive? Why am I so like blah, 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 blah? I'm like, am I psychic? Please read me my tarot cards. Like you can just get down this whole rabbit hole with
Uh,
AI.
chat,
So
chat GPT knows
I
too
use it
much
all.
about. Yeah, I know. Chat GPT
I
all
use
day, every
Claude.
day. Wow.
I use Quad. Yeah, because I was a blogger before I started YouTubing. I didn't have the like a lot of my friends like 10, 15 years ago used to tell me to do YouTube, but I didn't have the confidence to do it. And so I started blogging because I felt like I still had that screen or like a filter. And then eventually now, YouTube's great and fun, but God helps a lot. Yeah, I use it a lot. I could use it more. I'm going to a summit here in a couple months with one of my assistants who's really good at AI. And I think for the like younger generation, the better that they can get at using AI to their advantage, they'll do really well because it's not going away.
No, no, and there's different companies out there that are growing in terms of CAT scan, like pre-planning diagnoses. I
Right.
mean, it hasn't. I feel like it hasn't rolled terribly into
Yep.
perio yet, but I would love to have something just populate how much CTG, how much connective tissue, or so how much attached tissue you have, how much recession do you have, and just pop it up there, just like you would caries detection.
Yep.
So in due time, perhaps.
Yeah, because they can't pick up on the soft tissue and they can't pick up on the buccal bone either, which is like what we care about, right? So there's gaps, but somebody's gonna figure out how to fill it in, and yeah.
Yeah, I
Um,
I know
okay,
ViewMedi. There's a company
before we
ViewMedi that's
go, what's next? Mm?
I was saying there's a
Who?
company called ViewMedi that's doing a lot of dental AI. They're growing in that space. You always
Nice.
cut that out also.
Okay, before we go, no, I'm like, no, leave it in. Organic. Oh, what's next for you? What's on the horizon? So you have dental defense. Are you planning on toothpaste, floss, toothbrushes, like interproximal tools? Like what's next? Private practice? Like what's on the horizon for you?
So I mean, I'm still in private practice, 5 days a week. I think for dental defense right now, we want to just keep growing as we're growing, uh, get that to where we want it to go, and that's really our only focus right now is just being really good at one thing. I mean, just like perio, I want to be really good at one thing, and I want a dental defense to be really good at one thing, which is a once daily mouth rinse for
Yep.
patients with dental work. And so I would love for that to grow
Yep.
beyond anything we ever dreamed. And at which point, then we could always cross that bridge. But right now, I just want to be really good at one thing, and that's just a once daily mouth rinse for implants.
That's really smart. I think that's really, really smart. What is it? Jack of all trades, master of none is the like saying or the phrase.
Of course.
Yeah. All right. So where can everybody find you
In terms of
or
what? In
dental
terms of
defense?
so you can go to ddsrinse.com.
Social media, where to buy. There we go.
That's right
And
there.
then
So you go to
and
ddsrinse.com. You could find me on Instagram at Dr. Steve Litwin. You can do dental defense at dental defense on Instagram. If anyone wants free samples, we'll mail you a
mm-hmm.
bunch of free samples, bunch of paperwork, whatever you want. Throw some swag in there. I know Dental Defense sponsored your last event there. We had some mugs
You
sent over and
did.
some
Yes.
surgical scrub caps. So we'll throw that in for you. If anyone wants to have some free samples, we'll throw in some free swag for you and your team. But yeah, ddsrinse.com. Just sign up, and it doesn't cost you anything, and we'll just mail it out to you.
Yay. That's okay. All right, friend. Thank you so much for doing the podcast, taking time out of your
My
day. I know
pleasure.
you're super busy. Um, and then everybody, I will link all the links down below on the description and can't wait. Wait, I almost forgot. I always ask two things. Number one, your favorite instrument, one that you cannot live without. One instrument.
Man. Not counting like a 15 or anything. Or Castro. I mean, I need a Castro. I think
Sure.
a Pritchard. I really love a Pritchard. I love a
Everyone
Pritchard.
picks, everyone picks, everyone picks Castro or the Boozer. You pick the Pritchard. Were you an oral
Yeah.
surgeon in your past life? Come on. But I'm not
No, but
judging, but okay,
it's like when
fine.
you're doing a hybrid. I mean, like when you're doing a hybrid, it's like the best. It's the best. It's the best.
Sure.
But if we're doing real
Okay.
perio, 24G all day. 24G.
Okay. All right. We'll stick with the Pritchard. Um, and then call up. Who would you like to see on the pod next?
You know what I think I'd like to say is Dr. Ansi Verdier. Ansi Verdier, he's the trustee for Tufts. He's a periodontist. He's a girl dad. He's a practice owner. He's just a really interesting guy with a lot of knowledge and just a wonderful willingness to share it. I think he'd be great.
You just connected us the other day. We had a little bit of banter going back and forth. Okay. All right. So we got to get him on the pod next. Thanks everybody for listening to another episode of Princess on the Pod, and I will see you soon. Steve, stay on really quick.